All right, we are heading into search mode with a story that is shocking many of you and me on Twitter. The Wall Street Journal says the FBI is now investigating Johnson & Johnson for what? A surgical device they manufacture that in some cases spread cancer in a woman's uterus. The device, a morcellator, removes uterine fibroids, but was pulled from the market last year when this all came to light. The question now is, what did Johnson & Johnson know, and when did they know it? Assistant professor at NYU School of Medicine, Dr. Devi Nampiaparampil, joins me now from New York. Dr. Devi, thank you so much for being here. How could a morcellator possibly spread cancer in a woman's uterus?
So it's a little bit complicated. I mean, the morcellator, when it first came out, it was really a miracle to some women because what it did was it treated fibroids. So fibroids are these abnormal growths in the uterus, and they can cause bleeding, they can cause pain, they can cause a lot of different symptoms. So the morcellator would go in through a tiny little incision, break up the fibroid into small bits, and then take out those smaller pieces. So the thing is, if you have a smaller pieces, it's easier to use a small incision. So women would feel better faster. They'd have less pain from the surgery. Now the problem is, if those small bits have cancer cells hidden in them, so the cancer's in the fibroid and you don't realize, it can spread in the belly when you break it up. So that's the problem, that these hidden cancers, suddenly when they get discovered later, they're actually further along than they would have been otherwise.
Okay, so I understand also that this procedure, obviously, like you talked about, is minimally invasive. That's why it is sort of a better procedure for some to use, why people opt to use this procedure versus others. Why not test for cancer before you use the morcellator?
You can, but there's not a great test for cancer in a lot of cases, especially these uterine cancers. I mean, normally the reason that you would check is if somebody has a lot of bleeding. Now, or pain, but they can have that from the fibroid also, so it's not the best test. I mean, you could do a biopsy, but even with a biopsy, you can only do that sort of after the pieces have been taken out. I mean, so this happens sometimes with new technology where you don't realize all the harms until later. The danger here, the reason there's a distinction, is because most of the research about this that we're aware of only came out more recently. But if it's possible that the manufacturers knew about it beforehand, then that would have been an opportunity for doctors and nurses, for the teams to actually educate the patients about this and maybe come up with a solution for it.
Well, and that's the big question here, right? I mean, this morcellator has been, it's being used for now 2 decades or so. Johnson & Johnson told the Wall Street Journal, quote, "The devices have always included cautions in their instructions for use about the potential spread of malignant or suspected malignant tissue." So if this is true, Dr. Devi, did the doctors know? And if so, why were they not at least warning their patients of the potential risk in using this morcellator?
Well, I think there's a difference, you know, when you talk about theoretical risks, whereas as opposed to if you actually know that there's a significant risk of having a problem. So there's sort of a range there. I mean, most people weigh their risks against their benefits, right? So they might be more focused on the benefits of a smaller incision, the idea that you might be able to recover from surgery more quickly, you might have less chance of infection. So it's really a balance. But
you know, it's still so curious to me, because if that risk exists where you're spreading cancer from a possibly, you know, stage 1 to stage 4 because of this morcellator, that to me is risk enough. Of course, so many questions. The FBI is investigating this. Dr. Devi, thank you so much for bringing some clarity to the situation. I suspect we're going to be talking a lot more about this in the coming future. Thanks for joining us.